There is how many? 5. Okay. Staphylococci. It's a gram-positive cocci arranged in clusters. It's a gram-positive cocci arranged in clusters. So what are the infections produced by staphylococci? That's what happens. You don't attend. No interest in the subject. You remember with ABC, abscess, boil, and carbuncle. Abscess, boil, and carbuncle. They also produce all pus-producing lesions. Wherever you see pus, you should remember staphylococci. So it infects almost all organs. 40% of hospital healthcare workers carry staphylococci in the nasopharynx. 40% of healthcare workers carry this staphylococci in their nasopharynx. So when there is diabetes mellitus, when there is a breach in skin, or if somebody do not carry, and lot of healthcare worker carries MRSA. MRSA stands for methicillin resistant staphylococci. MRSA carries for name, its MRSA long form is methicillin resistant Staphylococcus aureus. Methicillin, and one of the important organism that causes post-operative post-operative wound infection, and it also causes infection in the burns, infection in the post-operative wound infection and post-operative infection of the burns, post-operative wound infection, post-operative infection of the burns. So it can give rise to abscess in any organ, deep organ. It's one of the important organism which causes osteomyelitis. The staphylococci is, 2 C's are important. What are 2 C's? One is it is catalase positive. And coagulase positive. So catalase enzyme converts H2O2 into water and oxygen. You make a suspension of staphylococci, add hydrogen peroxide, there will be bubbling. Effervescence, due to effervescence of oxygen, there will be bubbling. Coagulase, which converts fibrinogen into fibrin and forms barrier around the organism, protects the organism from phagocytosis. Everybody recite with me. Coagulase enzyme produced by staphylococci converts fibrinogen, fibrin, protects the organism, phagocytosis, protects the organism from there are 2 types of coagulase. Everybody, there are 2 types of coagulase. How many types? There are 2 types of coagulase. One is bound coagulase. Everybody, along with writing, you have to tell bound coagulase. Another is tube coagulase. Bound coagulase and tube coagulase. Bound coagulase, tube coagulase. So bound coagulase is a part of the integral part of the cell wall. It is bound to the pre-coagulase is released. The bound coagulase is tested by slide coagulase test. Everybody, bound coagulase is tested by slide coagulase test. Bound coagulase is tested by slide coagulase test. Bound coagulase is tested by slide coagulase test. Take a saline emulsion of staphylococci and add undiluted plasma. There will be clumping. Repeat with me. Write down and tell. Take saline suspension of staphylococci, add plasma. There will be clumping of the microorganism. There will be clumping of the microorganism of staphylococci. There will be clumping of the staphylococci. Now coming to the tube coagulase. Everybody, tube coagulase is done to test the free coagulase released into the circulation. Free coagulase is done to test the free coagulase into the circulation. Free coagulase into the circulation. Free coagulase into the circulation. It is tested by tube coagulase test. Everybody, it is tested by tube coagulase. It is tested by tube coagulase test. It is tested by tube coagulase test. Take 0.5 ml of the broth. Broth is liquid culture of staphylococci. Everybody, take 0.5 ml of staphylococcal broth culture. Wherever you see broth, it's a liquid culture. Okay. Take 0.5 ml of broth culture. Everybody, take 0.5 ml of broth culture. Add 0.5 ml of plasma. Incubate. Everybody, 0.5 ml of 1 in 10 diluted plasma. 1 in 10 diluted plasma. Everybody, add 0.5 ml of 1 in 10 diluted plasma. Incubate at 37 degrees for 4 hours. Incubate. Everybody, incubate at 37 degrees for 4 hours. And at the end of 4 hours, there will be formation of thick coagulum. There is a formation of thick coagulum at the bottom of the tube. There is a formation of thick coagulum at the bottom of the tube. The difference between bound coagulase and free coagulase is it requires the help of CRF. CRF stands for coagulase reactivating factor. CRF stands for coagulase reactivating factor. Coagulase reactivating factor. Bound coagulase does not need the help of coagulase reactivating factor. Staphylococci is a pigment producing organ. It produces non-diffusible pigment. Staphylococci is a pigment producing organism. Important pigment producing organisms are Staphylococcus 1, number 2 Serratia marcescens. belongs to gram-negative bacilli. Then a typical mycobacteria. Depending on pigment production, they are classified into photochromogen, non-chromogen, rapid growers. So these are the important organisms which produce pigment. So pigment production, depending on pigment, they are classified into aureus. Aureus, golden yellow pigment. Golden yellow pigment, albus. Everybody, aureus, golden yellow pigment. The pigment is made up of beta carotene. Pigment is made up of beta carotene. Albus, egg white. So remember crown. So it is golden yellow color. Remember egg white, egg white. Okay. Then citrus fruit, citrus, Staphylococcus citrus, citrus fruit, lemon colored pigment, lemon colored pigment. So source of infection is human nasopharynx. Lay person is about 10%. Hospital carrier is healthcare workers. They carry in the nasopharynx. They carry in the nasopharynx. Nasopharynx. They carry in nasopharynx. Here, nasal and pharynx. Okay, and it goes up to 40%. If 100 people are working in hospital, when do a nasopharynx swab, 40 people out of 100 people will be carrying Staphylococcus in their nasopharynx, and out of them, about 5 to 10% will have methicillin resistant Staphylococcus aureus. Methicillin resistant. The only treatment for methicillin resistant staphylococcal infection is vancomycin, vancomycin and linezolid. Vancomycin and linezolid. Staphylococci, most of the time they gives rise to pus producing lesion. It also gives rise to non-pus producing lesions. Everybody, non-pus producing lesions. Non-pus producing lesions. There are three. Hold like this. This is due to enterotoxin. This is due to enterotoxin and exfoliative toxin. Enterotoxin and exfoliative toxin. There are enterotoxin classified into A to F. Enterotoxins are classified into A to F. A, B, C, D, E and F. So it gives rise to food poisoning. Gives rise to food poisoning. Food poisoning, usually the meat, fruit salad, dairy products are responsible, and incubation period is short. It gives rise to vomiting and diarrhea, and it's self-limiting. With or without treatment, people will become all right. The second one is toxic shock syndrome. Toxic shock syndrome. Usually, females suffer from this because when they use tampons during menstruation, if it is contaminated, it gets into the circulation. There is a massive cell-mediated immunity as well as a complement, and gives rise to hypotension and severe necrosis of genitals, and people may die. Female may die of this toxic shock syndrome. Yes. Third one is SSSS. Everybody says staphylococcal superficial skin scalded syndrome. SSS. Superficial staphylococcal skin scalded syndrome. Superficial Skin called it syndrome. Superficial skin called it syndrome. So staphylococci is a very important. Most of the whenever you operation or burns or accidents, road traffic accidents, pneumonia, pharyngitis, respiratory infection. So it is present everywhere. Staphylococci is a very important organism in the hospital. We are scared about this organism. So because it is multi-drug resistant. I mean, it is drug resistant because of it produces enzyme called beta lactamase. It is so all the beta lactam antibiotics, all beta lactam antibiotics are made useless. All beta lactam antibiotics are totally useless when they start producing this beta lactam ring. So we have add beta lactamase. They are called BLIs. BLI, beta lactam inhibitor. What are this beta lactam inhibitor? There are three: tazobactam, galvanic acid, sulbactam. Tazobactam, galvanic. Write down. Tazobactam, tazobactam. Remember mnemonic TCS, software company TCS. Tazobactam. Everybody, tazobactam. Recite tazobactam, galvanic acid, sulbactam. Tazobactam, galvanic acid, and sulbactam. So you must have heard a very common name, augmentin. Amoxiclav. It is amoxicillin with galvanic acid. Amoxicillin 650 DO. Augmentin 650 DO. Most of them you must have taken. Amoxiclav. Amoxiclav or augmentin DO 650 DO. It consists combination of amoxicillin and galvanic acid. We'll continue in the next class. Tomorrow is also class at 1:30. Tell all your friends if they don't come to the this additional classes, they will not be allowed to attend the regular classes unless they bring the parents. Spread the words. Spread the word among them. Put it in the group. I'll also put in the group.